from the Bay Area's local news station.
So as the president is in the air right now on the way to Walter Reed to be treated for coronavirus for the next several days, we are joined on the phone now by an infectious disease specialist. This is Sherah Batemen, who's with Marin County Health. Thank you for joining us here on KRON4 News during our breaking news coverage. We're looking at this image now of the president being able to walk. He is wearing a mask. He's on his way to the hospital. We know that his symptoms are somewhat mild, but he has a fever and that he's fatigued. I know you're not his particular doctor, but since he's able to walk, what does that say about how sick he is and what kind of treatment he will have?
Well, thank you guys for having me. I'm not a physician myself. I'm an infectious disease preventionist or an infection prevention specialist. And so basically, just looking at that picture, it hopefully is going to be a mild case, but it's really hard to say at this point. I mean, you're going to have to wait and see, I guess, what happens within the next couple days.
And while he's at the hospital, they're saying he's going to be well enough to work. What are the treatments they will be doing for him? As we are looking at video right now of the president. Here he is. He gave a thumbs up to the White House staff who's standing out on the lawn, as well as all the reporters who were gathered there, giving a thumbs up, waving, and clearly wearing a mask as he walks out, wearing a suit and a tie, his hair combed back, on his way to the chopper that will take him to the hospital. Sorry to interrupt you there, but I just wanted to let our viewers know what we were looking at.
Yeah, no worries. Well, again, it's just going to be up to his physicians in terms of how they're going to treat him. I can't speak directly to that, but hopefully I'm sure he's going to receive the best care possible.
Do you know anything about this this dose that he received that reduces the virus's levels and the symptom, this Regeneron? It was this antibody cocktail that he was given. Do you know much about that and how that would help him get better?
I don't actually know much about that. My specialty is more in terms of the prevention, and I can speak more to that. One of the things you guys were talking about was the masking, and I think this is a really good example to the White House and to everyone in the United States that you must wear a mask when you're out in public around within 6 feet of other people. And that really is the most important point here I think I want to make, and also the social distancing. Masking is very, very important. It's also the amount of time you're around people. And it's also making sure that we don't have a lot of big gatherings. And so I think, this is a good example to everybody that it can happen to anyone. It doesn't just pick, certain people here or there. Everyone is susceptible to it, so we all have to take the right preventive action.
The video that we just saw, though, did show that the other people who got on the helicopter with him were also wearing masks. And
That's
Catherine
great.
just had a question for you.
Yeah.
One of my questions, and we're hearing this from medical experts today, and it's a good reminder. Democratic presidential nominee Joe Biden and his wife, they both tested negative for the virus. We know that Mike Pence has tested negative, but we're also hearing from a lot of public health experts today reminding us that it could be days before any of them can be assured that they are not infected. In other words, you can test negative, and then in a few days you may test positive. Is that accurate?
That is accurate, yes. So usually what we say is if you are potentially exposed to someone, you don't want to get tested right away. You usually want to wait until day 5 after exposure. You want to quarantine yourself from that day of exposure, but you want to wait until about day 5, maybe day 5 to 7, because at that point, you probably, if you test negative, it's probably a true negative. But if you test, day 1 or 2 after exposure and it's negative, there's still a possibility you could be positive. So this is one of those diseases where you don't want to go out immediately after potentially being exposed and get tested. So that's a great point to make. And usually we say about day 5 to day 7 after exposure to get tested.
Joe Biden is maintaining some of his campaign activities. They've been curbed, but he has still been out there. Is that pushing things a little?
Well, it's always good to avoid large gatherings. The best thing, if you have potentially been exposed, is to, of course, stay home in quarantine for 14 days. That's the recommendation. If people have to be out and have essential activities that they have to do, they need to wear the mask the entire time, not be within 6 feet of others. And so it may not be the best thing to be out campaigning at this time. But again, I will defer to, his health experts that help take care of him.
All right, we're
And
seeing the
Captain,
military
you see
helicopter landing, Justine, at Walter Reed Hospital. And again, the president looking fairly robust as he got on board himself. And it's an 8-mile trip. It didn't take very long from the White House to Walter Reed. So, of course, we'll be watching. We presume that he will walk off the helicopter again himself and get into the hospital.
Yeah, the pictures here showing us the helicopter has just landed. We'll see. I didn't get a great look at who else was on the helicopter with him when it took off from the White House, but you saw how quick that trip was. A couple minutes long. But the president is going to stay here for a few days. I don't know if Sherah's still on the phone with us, if we can ask her some more questions.
I'm here. Yep.
So since the president is in this bubble and he is able to get coronavirus, what does that say to you for the rest of us about our chances of getting sick?
Well, one of the things I want to speak to is the fact that, I think he's been somewhat adamant about masking not always being as important. And really what I want to say is that if you have to go out, and if you know you're going to be around others that you don't live with and you're going to be within 6 feet of them, wear the mask the entire time. That is your best insurance from this disease, the masking and social distancing. And, of course, you want to clean your hands as well. That's also just as important. But I think as long as you follow those things, your risk is going to always stay low when you veer off of that. And I think, again, everyone is susceptible. It doesn't matter, your age or your race or your socioeconomic status. This disease has touched all lives, unfortunately.
We're talking again about the range of symptoms that we're hearing about. We don't know what we're not hearing about, but basically it's being pointed out the president has not tweeted since about 1 a.m. Friday when he announced his diagnosis. We're told he was lethargic, he fell asleep on the way back from a fundraiser in New Jersey Thursday night, which they say is very unusual for him. And we are hearing about, at least we know about, a fever, a cough, and that lethargy continuing. What are the kinds of symptoms or the range of symptoms that may or may not be ahead?
Well, yeah, so, not everyone shows the same symptoms. Some people have a fever and others don't. Some people might present with a sore throat. They might have congestion. They might have loss of smell, loss of taste. Some people might have shortness of breath, which, of course, is going to be more severe. People might have coughing. So it's really one of those things where, everyone kind of presents differently, and that's kind of, I think, why this virus is scary, because there's not a set of symptoms that everyone's going to present with. And so I think if you start to have any kind of cold, flu-like symptoms, that could potentially be COVID. And so you would want to be aware of that and get tested.
We are watching now. The president has gotten out of the helicopter. He gave a salute. It looks like he's boarding onto some SUVs that will now take him to the hospital. The camera is going to pan out a little bit so we could see. There's the White House photographer. I also saw the chief of staff, Mark Meadows, was on the helicopter with him, and some other staff members here as the president now into one of the SUVs close to the. Even though he's wearing a mask and they're wearing a mask, should they all be tested?
So they should be tested if they were exposed to him without a mask. And so it's really hard to say because I didn't do the contact tracing on these people, and I'm not sure. Hopefully someone is doing contact tracing. I'm sure they are. But it's really hard to say without that information. But the people that are around him, the people that have been within 6 feet, have been around him unmasked for greater than 15 minutes or more. Those people should be tested. And so hopefully all of that is going to happen.